My name is Roger Mead. I'm recently retired as a physical therapist at Carolina Spine and Mountain Neurological Center in Asheville, North Carolina. I was there 23 years working with SwimEx pool. I've been working with pools for approximately 33 years. I hope these guidelines will give you some ideas of how to work with neurological patients.
The utilization of aquatic protocols with neurological patients is very different from an orthopedic protocol development. Every neurological diagnosis involves the following: a neurological progression, problems cause the body to fail to deal with the issues or symptoms, and finally, what does the patient control mentally and physically? All these areas you're trying to develop programs from so that we can improve the situation or maintain it or delay further negative issues of the neurological diagnosis. Aquatic advantages for a neurological challenge patient are the same for all patients: balance, strength, flexibility, range of motion, and secure environment. These advantages can provide to allow development, maintenance, or slowing decline of patient, but they must be developed in relation to mechanisms of each diagnosis and how the body is challenged. We know in Parkinson, working outside the patient's comfort level can slow progression and ease symptoms. Multiple sclerosis, maintaining active musculature is key to long-term quality, but activities in high-temperature environments can be destructive. Alzheimer's disease, multitasking can be a frustration and a detriment to quality of rehabilitation experience. Finally, while there are hundreds of neurological diagnoses, one must consider other detriments the patient has related or not related to the diagnosis. Decondition, educational level issues, home environment, communication ability, all these will impact your rehabilitation program. These protocols are based on the level perceived by the therapist of where a patient must start to be successful in the following areas. 1. Balance improvement in dynamic situations and functional challenges. 2. Strength training between functional musculature to improve efficiency and safety in activities of daily living. 3. Flexibility/range of motion to improve joint potential. Assist fall prevention. Work with balance and strength to maximize functional movements, improving activities of daily life and overall confidence. 4. Safe environment for the patient feels they can challenge themselves without danger. Always start with basic positions shown in photographs. Remember, there are no true position exercises in water that are static. Buoyancy, water movement, water resistance, therapist involvement makes all exercises a type of dynamic movement. Current at low levels will force patients to use trunk stability and segmental movements, crucial for progression of functional movements needed for activities of daily living. The following visual aid shows suggested progressions. Videos shows standing on both feet, standing on one leg, standing with body rotation, using current, walking forward and backwards steps, marching, side step with varied current. You will notice that we always use head movements when we're trying to establish our level of participation of the patient and the success they'll have. You'll notice in this patient who has no neurological issues, when he looks down with his head, you'll notice a substitution where the left shoulder shifts back. These are the type substitution patterns you have to look for in these basic opening patterns of balance. These will throw you off later on if you do not correct them at the simplistic stage. And it's very easy to work with it with light current, but once the current goes up, it's more difficult to correct substitution. We then show a patient walking in the current, very light current. And these all provide the therapist with information on where we should start in relation to developing balance. One of the more difficult things for a patient to really deal with, especially with neurological issues, is standing on toes, standing on heels. Again, you really are not concerned whether they're really good at it. You just want them to try to coordinate it, to integrate it into their ability to balance. Using current may or may not be helpful in this situation since it's a very unstable position. The therapist may need to be with them. It is very helpful. It works extremely well
We typically do it with eyes open, not eyes closed, but there are folks that do it both ways. Walking forward and backward with current is another way to let the body get a proprioceptive sense of where it is. The movements are slow and purposeful, but the current you can increase to make it more and more difficult. As you work on the walking in the water, having the patient reach from side to side with rotation can also influence their ability to balance and be safe. It also helps them responding to loss of balance to correct it for possible falls. Very simple to do. The patient is usually very responsive to this. The therapist maybe have to be in the water to support. Throwing the ball to the patient to play catch with and throwing the ball from different directions and different levels will assist the patient in learning functional movement and balance. We also play a game which we played as a child called I Spy. This forces a patient to attempt to look around the room trying to find the objects that we are identifying or giving them information about. The game can play as elementary or as difficult a level as possible, but the main thing you want the patient to do is to change positions and change levels of eye focus to assess with the balance and the functional components of that. This is also a way of working at trying to prevent fall, and this initial stages for trying to work in that area. There are all kinds of toys you can use in the swimming pool. Here you see a kickboard being used to increase resistance. This also helps you with building your strength, also helps you with your balance. You can do slow pattern movements. Just make sure the kickboard is staying under the water at least 2/3 to get significant resistance. Doing slow marching, one leg to the other leg, is another way to teach the person how to shift weight from one leg to the other leg, keeping focused on a position straight in front of them or a view just in front of them. Current can be increased to whatever level they can tolerate. If a patient needs to help them with this, be very careful about not giving too much sensory input from the patient, because this can really throw the individual off. A squat position with trunk rotation, swirling a hand through the water, can be turned into a PNF pattern if wanted. It's a good way to develop functional movement patterns. It's also a good way to build strength into the hips and the back extensors and the quads. Again, you're looking at people that are probably deconditioned. You have a patient here that you're looking at that has no neurological issues. So keep that in mind. A lot of these techniques will not be as easy as they appear. We're now moving the leg motion. We're really just trying to see if we can balance on one leg while moving the other leg in space. You could turn this into a PNF pattern or all types of different components of reflexes and involuntary movements to help you get the motion you want. Never forget the need for trunk mobility and head motion. As we know, neurological patients have a difficult time if that head is not in the correct position, and a difficult time maintaining a correct position. Spinal cord patients present other issues. They still have balance, strength, functional motivation, movements that you have to get. But the real issues you got to look out for are pressure sores, which could cause infection. Anybody that's T6 and above might have an autonomic dysreflexia possible, difficulty to control body temperature. So be aware of your water temperature. Bowel and bladder issues, you may need to work your schedule with the patient's bowel and bladder program. They also have many issues with transfers. Many pools have chairs that can get them in. But the bottom line is you're working on the same type of scenario. You're still trying to develop strength in what is available. You're still trying to develop balance in what's there. You're still trying to develop functional range of motion, and you're trying to put them in a safe environment. Complications of a diagnosis. If a patient is significantly deconditioned, do not start your conditioning program until you're sure how neurological diagnosis will respond. Make sure program for conditioning works functionally and not trying to isolate weakness. Neurological issues can be improved, maintained, or slowed, but isolated movements usually result in negative responses. Using the whole body to facilitate neurological weaknesses appear to be more successful in the water. As you build a program, do not forget that buoyancy and current provide sensory input to the patient. They can assist or hinder your patient.
Be aware of medication patients are using for their problems, not just neurological. Medication will be used for pain control, tremor control, brain function, etc. This can inhibit patients' ability to follow directions or plans. Keep programs simple until patient therapists have developed baseline and then add more complicated programs. Summary. Neurological diagnoses are complicated in presentation, origin of issue, and potential progression. A therapist cannot have a specific program for Parkinson, multiple sclerosis, CVA, etc., without an understanding of how aquatics will impact that specific patient neurological issue. Start with basics until the therapist is confident that the patient is comfortable in the water and the therapist sees the positive and negatives of aquatic treatment for this patient. When this is identified, progression to more specific neurological programs like PNF, NDT, etc. make good sense, especially if you're working toward land program. The success of the therapist program will be based on acceptance by the patient, the ability of the patient's body to handle the program, and a program that can be continued outside the therapy environment. Aquatics provides a safe, supportive environment to initiate therapy with neurological issues. The program can be independent in community at YMCAs, community pools, and gyms if that is the need for long-term exercise. Aquatics can also be the initial step in rehabilitation to a land-based program that will allow independence for the patient in their own environment. We recognize these are basic concepts for utilization with neurological patients. Therapists will have to deal with age of patient, type of diagnosis, patient availability for treatment, etc. Please look at your situation and use the above information to support you, but not necessarily guide you to a program. The therapist is the one that must work to get patient back to their maximum ability safely, confidently, and securely. Aquatics is a tool, a very helpful tool, a very adaptable tool, a confidence-building tool. Use it wisely.